Welcome, everybody. Hello, everybody joining us from Facebook. Welcome to tonight's Healthcare for Us Education Series event. I've been kicked off my insurance. Now what? My name is Erica Ferriston, and I am honored to serve as the chair of our nonprofit, nonpartisan, all volunteer organization, Healthcare for Us. We are dedicated to achieving single payer healthcare here in the state of California and fighting for healthcare justice. And thanks to the California nurses and reintroducing the California single payer bill, Calcare, we are in organizing mode. So
California single payer bill,
we got some feedback there.
We are in organizing.
Okay. But anyway, so yes, we've got Calcare. Calcare is back. We're going to be talking about some upcoming actions toward the end of the meeting to plug you guys in. And so while we are working to pass Calcare, we understand that many individuals are currently struggling to navigate the complexities of private health insurance and Medicare. And so tonight's workshop was created, with those in mind who have perhaps recently lost their jobs. There's been lots of tech layoffs, lots of layoffs at Disney, those in between jobs, those who just turned 26 and no longer qualify for their parents' insurance. And so the goal of tonight is to equip you with tools on how to navigate this American health insurance hellscape. So let's see, our program's gonna run, I don't know, I'd say about an hour and 45 minutes in total. Our speaker, Jeanna Harris, is going to give a presentation, and that will be followed by about 20 to 30 minutes of Q&A. And then we'll close it out with some actions that you can take. So before we begin, we want to give the following land acknowledgement borrowed with permission from White People for Black Lives. Healthcare for Us recognizes the Tongva peoples as the traditional caretakers of the land we currently reside on. That is the Los Angeles Basin and Southern Channel Islands. We seek to honor the land and the courageous people who have been its stewards, modeling a tradition of resistance seeking liberation. We pay our respects to ancestors, elders, and relations past, present, and emerging. And if you are outside the greater Los Angeles area, you can find out whose land you are on at native-land.ca. And so with that, I'm going to introduce our speaker, Jeanna Harris. Jeanna Harris is an RN. She has her BSN, she's a PHN, and if you don't know what all those things means, it means she is a badass nurse, and she's also a badass social justice activist. Jeanna has worked in multiple clinical settings, including medical, surgical, cardiac rehab, acute dialysis, transplant units. She is a nationally board certified RN case manager, facilitating the coordination of patient services for hospitalized patients to ensure they have safe discharge plans and services both during and after discharge from the hospital. And so this allows her to have direct interaction with our health insurance system. And so that's why she can help us out with navigating this tonight. Jeanna also represents the 61st Assembly District as a member of the Los Angeles County and State Democratic Central Committees. She has been a DNC delegate for Bernie Sanders back in 2016 and 2020. And she serves on the board of Healthcare for Us. So Jeanna, take it away.
Thank you, Erica. Serving on the board just means I do this for free, as we all do these things for free, out of the kindness and love for our community. So thank you. So yeah, what Erica said, we are fighting for the single payer healthcare system. But in the meantime, that we still have to survive, right? So every day I work, I just got home from work about an hour ago. And every day I'm helping people navigate this insurance system. And that's helped me learn. I wouldn't say I'm an expert. My board certification says I kind of am, but I will say I'm not an expert because it is so vague. It is so ambiguous. It is so many big words that the average person I wouldn't think would be able to get through this. So, I had this idea of like, hey, you know what, let's help people. Let's help people along where they are right now. As we're fighting for single payer, we need to also help people along navigating this current system. Thus, we came up with this presentation. So I'm going to share my screen because I'm going to act like I'm edumacated, and I created a PowerPoint. So here we are. I got kicked off my insurance. Now what? And thank you to Bronwyn Major for making this awesome graphic. You are amazing. Thank you so much. Recently laid off, ineligible for parents insurance because you turned 26. And just because you turned 26 doesn't mean that you have a good enough paying job that provides benefits, or you're still in school trying to get that good paying job that will provide benefits. So let's learn how to navigate, our twisted health insurance system. And hopefully by the end of this, you'll see why we're doing what we're doing in this organization. All right, so what is this about? So this is about our goal, which is to provide an insight into the complex navigation of this world that we call insurance. That's whether you're selecting your benefits for the first time or you're just overwhelmed after losing a job. The bigger goal is we want to, pass and implement Calcare so I don't have to do this. Basically, that's pretty much what the goal is, to make me not have to work so hard. Don't you care? Don't you want me not to work so hard? I know you do. Thank you. All right. Here's some not so fun facts, though. This is recent, coming out of the state of California's affordability and budget report, one of those reports from a study. Don't we love the studies? But this study revealed that roughly 3.2 million Californians still lack health insurance in 2022. Granted, I will say caveat, that is a much larger improvement from before the Affordable Care Act in 2010, but neither here or there, that's still too many. So you see that these people, we have people who would be eligible for employer-sponsored insurance at 480,000, eligible for Medi-Cal at 610,000, eligible with Covered California, or you have undocumented. So down here at the bottom, there's that little A kind of like to give you reference. And it says the A where it says eligible for Covered California without subsidies A, that means they're documented residents who can purchase plans through Covered California, but they didn't meet the federal requirements to qualify for subsidies. And I kind of, that just makes me cringe a lot, because in California, where our cost of living is so high, plus inflation, our money does not go far. And the qualifications, the federal income poverty limits are so low that pretty much you cannot make any money if you need to qualify for a subsidy. And so I really wish that they would rethink these income limits, but they haven't yet. So a lot of us are left in the void. And then B, it's just a number that, it's a previous, it does not reflect a previously authorized expansion of full scope Medi-Cal benefits to undocumented undocumented residents who are 50 and older. And that was implemented in May 2022, which is after a lot of this data was pulled. So we did see a Medi-Cal expansion, but we'll get into that. We'll talk about that. Okay, so the other side here, we have, the medical prices have grown significantly faster than non-medical prices in the major California areas, according to the CPI, or Consumer Price Index. So medical inflation's hitting even harder than non-medical inflation. So you think the cost of eggs are high? Try the cost of a bag of IV hydration because you got too nauseated and can't keep food down and you need to be hydrated before your kidneys fail. Yeah, it's expensive. The reasons for that vary. You know, a lot of it was the supply chain due to the pandemic, limiting a lot of production. But then other part of it is a little bit of greed because, you know, who's going to regulate you? And nobody's going to question medical prices, but guess what? We're here to question medical prices. So like this just shows, like I said, a very, very bad, not so fun fact. Things are getting more and more expensive, and it is hitting even harder on the medical side. Okay, so let's learn some lingo. You know, I tend to not be one of those people who like to read from the slides and just go womp, womp, womp. But I think that this is really important to learn some key terms here and some definitions so that going forward, you understand as you're navigating open enrollment periods, different things, getting yourself enrolled in insurances or helping a loved one, however. So let's learn some lingo because you hear these terms, but very many people actually know what it means. So the Patient Protection and Affordable Care Act. I think by now people know what the Affordable Care Act is, the ACA, the Obamacare, but really it was a law passed by Congress in 2010. Caveat, what was the intent of the Affordable Care Act is not the actual Affordable Care Act. As you know, our Congress, they beef more than Bloods and Crips and cannot agree on much, especially when it comes to helping the American people. But they were able to pass something. So this law in 2010 passed along party lines. It did expand insurance coverage in the United States pretty significantly, but not universally. And it expanded eligibility for Medicaid. It established the health insurance exchanges and the subsidies to help offset some of the costs for lower income Americans so that they may be able to purchase insurance through these exchanges. So, you know, it did, it also expanded the age of coverage for people who are, you know, young people who are under their parents' insurance to 26. It did also, they did have the individual mandate, basically, you know, where you would have to establish like standards for health for covered benefits. But like I said, it still was not what we really want and what we really need. So that's the ACA. So now going forward to what, if you have been, you know, kind of, you've lost a job, left a job, been laid off, you have heard this term COBRA. And COBRA, you know, is a federal law that passed in 1985 that gives workers the right to maintain health insurance in certain circumstances after they leave a job by continuing to pay some or all of the premiums for that insurance. I would say about 90% of the time it's all. And we'll talk about COBRA a little bit more too. So then co-insurance, which me and Erica were just having a discussion about this right before we got started. So co-insurance, it's a cost sharing. So basically this is the what you see when the procedure or office visit or whatever is not fully covered. So you might see a 80-20 split, 60-40 split, something of that sort. And this is actual cost sharing. So whether you meet your deductible or whatever, this is the amount that 80% or so will be the amount the insurance is going to cover regardless. So you'll still be on the hook for 20%. Unless you have a secondary insurance, which most people don't. So a lot of times you will end up having to pay that cost of that 20% of whatever the fee was for that procedure or visit that you had. Now copay, right? So the copay, now that's different than co-insurance. Stick with me. So the copay is that charge for, you know, where you go for an episode of care, you have, you know, for a service or prescription. That's what you pay when you go to, you know, the doctor's office and they say, okay, welcome to your, you know, doctor's office. You have a $20 copay. Or, hey, you know, sorry that you got sick and you need this antibiotic, but the antibiotic has a $35 copay. So that is what you pay. It's kind of a charge per, you know, episode or visit. But it is not necessarily a co-insurance. That's just the copay. Okay. Covered California. So going back to that ACA thing, so Covered California is the insurance exchange for California. This was what we created after the Affordable Care Act. The deductible, going back to what we were talking about, co-insurance, co-payments, deductibles, blah, blahs, all confusing. Either way it goes, you pay money. So the deductible is another kind of cost sharing feature. Okay, but you're required to meet your deductible annually before the insurance benefit kicks in. Okay, so basically, you know, there's these plans where it's like, oh, well, you have $1,000 deductible. Well, the $1,000 deductible has to be met before it will cover, you know, that service. Now, preventative care is waived from the deductible. So, and that we'll touch on that a little bit later too. And the health insurance exchange, as I explained, is what was created under the ACA, allowing people to purchase individual insurance. Each state should have an exchange. I think there are a couple of states, I believe, that may not have an actual exchange, but don't quote me on that. California does. And so for the sake of keeping things simple, we're going to focus more on California during this presentation. Health maintenance organization, the HMO, aka Kaiser. So that's managed care that provides, you know, like a capitated or more like, I don't want to say all inclusive, but they're more like all restricted. You are in the network, and so they basically manage your care with utilization reviews. They emphasize on preventative services, and they can be, they actually could be a little bit more inclusive in the sense that they will cover a lot more with less cost as long as you stay in their network. So Kaiser will cover a lot, and the cost will be not as high, but you better stay in Kaiser's network. And if you go to a hospital outside of Kaiser and short of an emergency, they will bring your butt back to Kaiser. That is something I do on a regular basis, which is transfer patients back to Kaiser because they want their patients back. Now, you know, if you, like I said, that's caveat is if it's an emergency, we will stabilize you and then you get transferred back to Kaiser. Oops, sorry about that. So the health savings account, I know I added this in because someone recently asked me about a health savings account. And so the health savings account is like a, you know, it's a tax, kind of like a pre-tax, you know, a withdrawal from your paycheck that you can sign up for during open enrollment to avoid, you know, paying taxes on that income, but it also makes you are able to use it for a qualifying health expense. It's not the same as a flex spending account. So health savings accounts are a little bit different and typically go hand in hand with the next one, which is a high deductible insurance plan. Oh boy, do I have, I don't know who created these things. I don't know people. So the plans with the high deductibles are designed to basically insure against large catastrophic costs. So basically, I'm young, I'm healthy, I don't have issues. Oh no, I got in a bad car accident. A high deductible plan would basically put you on the hook kind of for a big chunk of that, except unless you go over it. So unless you, if it's an emergency, you will over your deductible, like the cost, then typically, you know, you will not have to pay that if it's during that admission. But there are times, and they get a little tricky, you have to really if you're signing up for a high deductible plan, you really have to read that fine print on what will qualify to waive your deductible, because there are many different plans out there and they kind of all have a little different, but they're attractive to people who are on a budget. Because they do have low monthly premiums. So the reason why they go hand in hand is because if you do a high deductible insurance plan, they typically will tell you to try to do a health savings account because you will end up eating a lot of healthcare cost if you get sick with just a flu or, you know, maybe a little stomach bug and you have to go to an ER. You can expect to almost pay 100% of that out of pocket because you probably will not get close to reaching that high deductible. Unfortunate. So just like I said, it's attractive to people because of the low monthly premiums. So networks, in network, out of network, you've heard this, right? You know about these terms. But what does that mean? So the networks are kind of like this list of providers on facilities that people with a given plan can use. Those covered or have more favorable rates to the insurance. Basically, insurance has negotiated rates. That's what your insurance companies do. They negotiate rates with the people they want in their network or the facilities or providers And those with the more favorable rates, you'll see that they have like maybe a tier 1 status, or they're preferred or something like that, whatever terminology the plan chooses to use to say in network. Those who have less favorable rates to the health plan, maybe some of the higher levels of care, that they will consider out of network, and you'll have higher cost associated with those. But really, the network is determined by the health plan based on the rates that are negotiated pretty much. That's just the, kind of straightforward answer to that. And then you have your premium, which this is pretty simple. The premium is what you pay, right, for your insurance. And then your PPO, that's the preferred provider network. That's kind of good for people who have a little bit, they can afford a little bit higher monthly premium, and they want freedom of choice. Freedom of choice. Does that sound familiar to my Calcare people? So you want freedom of choice. You can afford a little bit higher on your premium. You don't want to get bogged down with utilization reviews, to see providers and specialists outside of your primary. So people go with the PPO. Personally, I have a PPO right now, but I'll be honest, if I have a family, and that family has to go under my insurance, the way those rates are, I probably will have to switch my tail to an HMO real fast, because I wouldn't be able to afford it. I know doctors paying $800-900 monthly premiums for their employer sponsored insurance. To keep a PPO network, and Jeanna just can't afford that. So the point of service plan, these get a little bit tricky. They are basically a combination. It's a managed care. So it's basically like an HMO, but it also has some characteristics of a PPO, a little bit more freedom. The rates typically are a little lower than PPO, not as low as HMO, and your network gets a little wonky. You have some freedom, but then if you go to like a little bit outside of that preferred again, then the services get a little bit more restrictive. So point of service, basically, I don't want to say POS, but it is POS. Sorry. But just if you have a point of service plan, it's important to read really closely about that network. And then one of my favorites, single payer insurance. This is a universal health insurance program in which there is a single insurer, typically the government. This is like your Medicare, Medicaids, or in other countries, their national insurance programs. And so this is what we're advocating for here at Healthcare for Us, because we believe that having a universal single payer system will be beneficial to everyone up and down the state. Because if you have the same insurance as the governor and as Tom Cruise and as all these people, then likely the system will hellified improve. Okay. So this is a kind of a good talking point between single payer versus universal. Isn't it the same thing? So universal healthcare is kind of like, more of a like political economic situation, but every resident has health insurance that provides meaningful access to care. So universal is more of like, okay, you have it, you have access. There could be more than one insurer. And it has typically the same characteristics, that of most industrialized nations. So most industrialized nations either have a single payer or a universal healthcare system, except us, because we are extremely special. Okay. So going forward, so these are two terms that I wanted to really go into, which is open enrollment. So open enrollment, if you have an employer sponsored insurance, about maybe, September, October, you start hearing open enrollment season. And the same thing with Medicare, all the open enrollments tend to be around the end of the year, around the fall, so that you can sign up for your benefits. It will become active basically the first of the next year. January 1st is when new benefits tend to kick in. So the open enrollment is that period of time where you can sign up for new health insurance, adjust your current plan, or cancel your plan. It's only limited usually to a few weeks. So keep in mind, your open enrollment period, don't let it slip by. I hear a lot of people say that, like, oh man, I really wanted to change my insurance. I can't afford to keep the PPO and I really wanted to go to the HMO so I can save a little money. And then they forget about it and it's locked, and good luck getting your HR to allow an exception. So if you miss it, you have to wait till the next open enrollment period to make changes. So you're stuck basically, except when you have what they call a qualifying life event. So a qualifying life event is, I got married, congratulations. Or I had a baby, congratulations. Or I lost my job. Or I turned 26 and my job doesn't offer insurance, or I can't afford to pay the premiums because I have to pay my rent. So qualifying life events is an event that allows one to sign up for the insurance outside of open enrollment. This is very important. If you have a qualifying life event, you typically have 60 days from the qualifying event to sign up for a new health plan or get new insurance, which means going into COBRA and what they call CalCOBRA. So as I said before, this COBRA thing, you guys have heard it. Everyone usually throws these papers away, including myself, because I'm like, it's a joke, I can't afford it. But federal law does require that you get a continuation of coverage to you and your spouse or dependent children for up to 18 months. COBRA applies to employers with 20 or more employees, like federal COBRA. Now that's where CalCOBRA comes in. So California COBRA, because we have to have a Cal everything here, is a law that applies to employers with 2 to 19 employees. And it also will extend the federal COBRA benefits beyond 18 months to up to 36 months. So if you're federal COBRA, if you were a blessed soul that could pay for it, if you're paying for COBRA and you're coming to the end of that 18th month, CalCOBRA can keep it going for up to 36 months. So yeah, that's still a really high cost. Anyway, speaking of cost, so you can expect to pay the full cost of your insurance benefit. That's including the employer part. So your employer is paying part of your benefits. If you look at your check stubs, most of them will say, employer pay, health benefit or whatever, and then, employee paid. And so when you have the employee paid part, you're only paying a fraction. But when you're under COBRA, you're eating all of it, right? So if your insurance, the monthly premium for your insurance was 1,000, and let's say, your employer was covering 80%, which was 800, and you're only paying 200, now you're going to be covering the full 1,000 plus the 2% admin fee. So that is the cost of COBRA. I looked it up. An individual somewhere is paying $400 to $700 a month for COBRA, if you, like I said, are one of the fortunate souls that can afford it. Okay, so this is a very long condensed slide, but I just wanted to give the example of the qualifying life events. And so, like I said, I already getting married, having a child or adopting a child, losing benefits, or losing, a job, or the death of a person. So if, the person whose insurance you're under, passed away, you would be able, that would equal a qualifying life event. And these are just, going on and on as lists, qualifying life events. At the bottom, you see returning from active military duty, or, being released from prison. These are all things that are considered qualifying life events that would give you access to enrolling in insurance through like California, or, through an employer outside of the open enrollment period. Now let's talk about essential health benefits. So essential health benefits, they are a California law basically is saying that, under the ACA especially, they have now passed like almost every insurance needs to have these essential health benefits. And they include things like hospital care, your primary care, outpatient procedures, lab tests, diagnostic tests, preventative and routine care, mental health care, you know, emergency rehab, some home health, some emphasis, and nursing home care, and then prescription drugs and oral and vision care for children, not you, children. So that is what is cover, or substance abuse treatments, but those can be also limited benefits as well. So the substance abuse treatment, you know, and the oral and vision care, some home health. It sounds great. This seems like a pretty long list of things to cover, but trust me, coverage does not mean 100% coverage, and coverage also does not mean that it is easily accessible. But these are everything that each, you know, health insurance policy should be covering, these essentials with some degree of coverage. So preventative care, these are things like, you know, blood pressure, diabetes, cholesterol tests, birth control, cancer screenings. We know that, side note on the birth control, once again, I'm focusing on California. Other states, less progressive states, they may be trying to pull this birth control out of preventative care, even though this is pretty federal. But we're just being attacked there. So just note that this is still relevant to just California. If you're outside of California, please, please, please check with your state's health exchange. It should be the same. But like I said, there's just a lot of just unnecessary attacks on reproductive health right now. And so moving forward though, cancer screenings, like routine cancer screenings, if you are eligible. So if I'm 35 and I say, you know what, I'm curious, I want to have a mammogram, I am not in the frame, like in the criteria for routine mammogram prevented, you know, screenings. I don't have any history or family history. So my insurance may not approve a mammogram for me just because I want one. So just keep that in mind. Then, you know, vaccines, pediatrician visits, and then, like I said, vision and hearing for children and counseling regarding obesity. Now, the Affordable Care Act does require that these services be provided to you without any out-of-pocket cost. So if you're going to the doctor for your routine physical, you shouldn't really have any out-of-pocket cost, not even your copay if it's your annual physical, because this is considered preventative care, right? Now, if they do something extra, now this is the caveat again, this is why it's a little wonky. If they do something extra, let's say, you know, they did well, for speaking of reproductive health, let's say you went for a routine pap, you know, your routine pap smear, but then, you know, the doctor was concerned and did an ultrasound to see if you had like an ovary issue or something like that. That extends beyond preventative. So you may incur a little bit of cost for the ultrasound, right? Not the pap, but the ultrasound. So yes, they can be that petty, and yes, they can nitpick costs. But you know, the other thing too is also you should not have a bill for preventative care, even if you have not met your deductible. So keep that in mind. Because, you know, billing is not 100% accurate, and billers do mess up, and so do the system. So if you go for a preventative screening, just know that if you get a bill, you can push back, but they also can add things in. So it's important to ask, you know, what is preventative? Is this considered preventative? If they say, oh, by the way, we want to do this, 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 and this while you're here, those extra things that may be outside of that preventative world may actually be what you incur a little bit of a bill for if you haven't met your deductible, or if you have an expected co-insurance for whatever extra stuff that they did. Okay, so I just want to give you that little gem because people think that they walk into the doctor's office, and the doctors don't know, by the way. They have no idea when it comes to billing and payments, and they're not going to be the ones to tell you. But, you know, you can ask beyond like, oh, is this going to be, you know, part of preventative or not? And they should be able to, oh, well, no, this is just something extra we want to check. So then at that point, you'll have a choice to make if you want to go ahead and do that. Unfortunately, there's not going to be really a way to tell you the amount right away in the doctor's office, even though there is supposed to be accessible price transparency. There's just not like a really fast way of saying, okay, this is exactly what it's going to cost to you if you want to get it. So it's almost damned if you do, damned if you don't, right? Okay, so going into Covered California a little bit more, you know, this also, when you go to Covered California, the website at coveredca.com, Covered California, it also includes the health insurance, like Medi-Cal application. And then it also, like, the plans are broken down into 4 different tiers. So there's many different brands or companies that are in the Covered California exchange, all the names that you guys know, like Anthem, like Blue Shield, like, you know, Humana, United Healthcare, all of those different plans, Aetna, Cigna, all of them. They're in the Covered California marketplace, but they all kind of break down their different plans that they have in these different colored, or I guess, different colored metals, I guess. Sounds classist that you have, you know, bronze, silver, gold, and of course, platinum. And then also financial assistance is available, you know, for those who qualify, which, like I said, you know, there are a good portion of people who qualify, who did not fill out the application. So if you think you could qualify, feel free to fill out that financial assistance application. You never know. But there's still a ton of people who would benefit from it who don't. And so also, this is where you apply for Medi-Cal, okay? Open enrollment for Covered California does start November 1st through January 31st. So right at this point today, we are outside of the open enrollment period. But if you're having a qualifying life event, which is part of the whole topic of this, which is you getting kicked off your insurance, then you can go to the Covered California site as long as you're within the 60-day period of that qualifying event. And then this is just a picture of the covered health plans. Like I said, you have the 4 different tiers. You have bronze, silver, gold, and platinum. And so they, so, you know.
Randy Rainbow, yeah.
Oh, let me go on mute. So you have these different plans. Sorry, I'll go back. I'm gonna try to go back. It's not allowing me to go back. Sorry about that. We were doing so good. I made it to 15 slides without messing this up. I was proud of myself. Anyway, here we are. So Cover California, you know, like I said, the 4 metal tiers. So you see here, platinum has no deductibles. So yay, highest premiums. So that means you're going to pay the highest monthly out of pocket, even though it says lowest. But you still, and you have 90% coverage, right? So you can, you'll be having to pay these high monthly premiums, but you will have, like, it'll cover more. So the actual out-of-pocket cost outside the premium will be less, and you won't have a deductible. Confusing. I know, I'm sorry about that. Same thing. So you see it goes platinum covers 90, gold covers 80, silver covers 70 to 94, which is odd number 94. And then bronze covers about 60. So bronze coverage means you have the least amount of monthly payment premium, but you also will have the highest out-of-pocket cost. And I just feel like some of this is a little ass backwards, because if I'm on a budget and I need insurance and I have to, you know, I'm trying to pay the least amount because I have to eat and have a place to live. Now, if I get sick, I still have to pay the highest. So once again, we're backed into a damned if we do, damned if we don't scenario. I don't know very many people who are paying for a platinum covered California. I haven't really come across many patients I've seen that on. But I do see plenty in this bronze silver area. And so, you know, it just, to me, is very, like, I don't know, almost asinine that I'm even having this discussion. So I decided to do a quick calculation. So when you go to Covered California's website, one of the first things you'll see is that you can do a quick quote. And so I just doing some numbers. I looked up what's the average income here. And I looked up about average is about, you know, $50,000. And the zip code 9008, which is like Leimert Park, Baldwin Hills, a big chunk of, you know, kind of Black community. And so I just said, for me, right? Just for me. And I'm 35. And And so this quick quote is going to tell me I'm going to pay $321 a month for a silver plan. I'll be honest, I'm a nurse. I live on my own. I have to pay my own bills, my own rent. I can't afford that. Just straight up. I cannot afford a silver plan to pay $321 a month. I can't afford that. Now, here we go. I'm a nurse. I won't qualify for anything, no type of assistance because I'm a nurse. And so, you know, that will be the other problem. So I will be left to pay to go down into the bronze tier to probably find some type of insurance, which I'll still end up paying an exorbitant amount of healthcare costs, but at least my monthly payment won't be as high. So, you know, that's why I encourage people, please, if you are going through this, definitely fill out the financial assistance, unless you know that, like me, you're way outside the income limit. But if you're close or you're not sure, fill it out because, you know, it can definitely drastically lower the payment, which is definitely will help a lot, especially if it means that you can get a higher tier. Okay, so Medi-Cal. Medi-Cal is our Medicaid. You know, it's usually Medicaid across the other states. And so it is the free or low cost health coverage for California residents who meet that income eligibility. Medi-Cal uses those federal poverty limits of the current year to determine eligibility. Now, Medi-Cal coverage is available for individuals and families, children, and pregnant individuals. And the coverage tends to be, I'll be honest, bare minimal. The coverage for Medi-Cal, they just like when I was going over those essential health benefits, they tend to say, yeah, we cover. But once again, it's at places with Medi-Cal, where Medi-Cal is accepted, tends to be lower cost, lower clinics, or, you know, lower tier hospitals. And, you know, some hospitals do accept Medi-Cal, but it's like, oh, only Medi-Cal under, you know, with these certain medical groups or plans associated with it. So there's tons of different caveats. So I just say coverage tends to be bare minimal, and there's challenges to getting timely visits and procedures because of the minimal access to providers who provide, you know, who take Medi-Cal. So Medi-Cal, even though it sounds great and yeah, it was just recently expanded, it still is not providing the services that patients need. I get patients under Medi-Cal who get to me a lot when they have, you know, had their care ridiculously delayed. We're trying to finding a provider or finding, you know, and accepting someone who accepts Medi-Cal that can see them without taking several months. So it is, you know, still a system that really needs to be reevaluated and not just, you know, have people say, oh, well, you can get Medi-Cal, you're fine. No, you're not fine. On the opposite end of that, Medi-Cal does cover things that regular commercial insurance plans or even Medicare doesn't. So one of the big things that Medi-Cal covers that the others don't is caregiver support, which is huge, huge benefit to our seniors and disabled people. Caregiver support through in-home supportive services is a benefit extended to Medi-Cal recipients. So that is the opposite end of that. So when I see people have Medi-Cal and they, you know, are telling me that they're having trouble taking care of themselves or the family, I definitely am helping them and informing them of this in-home supportive services or IHSS to help them get caregiver support because they're the only ones that can access this benefit, honestly, at least for free. And then also, this is a very, very important thing to note. Medi-Cal must be renewed annually on your original sign-up date. So if you signed up for Medi-Cal and were approved today, then next year you're going to have to renew. Now, people forgot about this because during COVID, they stopped the renewal processes. And so that's going to be restarting next month in April. So if you are under Medi-Cal now or know someone who's under Medi-Cal, please let them know that their annual renewals the notices are going to start coming out next month. And just the estimate, an article from Cal Matters shared that they estimate millions of Californians can be kicked off of Medi-Cal if they do not respond to the renewal notice. So people may have moved, Unfortunately, we know with the restrictions and COVID restrictions lifting that people may have been even evicted. So if you know someone who is under Medi-Cal, please let them know so that they do not lose their coverage. It is so hard to get back under it. So please do not miss your annual renewal. Okay, so going into those income limits, Medi-Cal, or most consumers or people applying for Medi-Cal, if up to 130% of the federal poverty limit will be eligible for Medi-Cal. So 138%, I'm sorry, is like right around here. So for one person, you tend to need to make either 138, about $18,755 for one person to qualify for Medi-Cal. That is not even livable in California. Like literally, it's not. So that's why I keep saying these limits really need to be reevaluated. For a single person, if you just got kicked off your job, you're struggling to find a new one, and let's say you still have a little bit of income, maybe you're doing a little side money or, Uber, DoorDash, Lyft, something like that. If you're making more than this $18,755, you may not qualify for Medi-Cal as an adult, like an adult with no disabilities or anything like that. Now, of course, that number grows as your household size grows. But for the most part, I still think that these numbers are really, really low for people who are living in California, only because our cost of living is high. And I think that just needs to be looked at again. I know that that could be a reason why it's 138% and not just 100%. But I think it should be closer to 200% because, at $27,000, you still cannot afford to go buy a marketplace plan. Even maybe with the subsidy, when you're having to pay the average rent here in LA, which is getting close to $2,000 a month or more. So that eats up 27, that's $24,000 right there. So, what are you going to, how can you live off of the remaining 3180? You just can't. So, that's just my tidbit. That's my soapbox on this federal poverty limit eligibility. But unfortunately, especially when it comes to our seniors, we have a lot of seniors who are getting a little Social Security money and a little maybe pension, nothing to, jump up and down about at all. And they will not qualify for Medi-Cal because of, their income's just a little bit above. Now, typically they qualify for Medicare, but they're also paying premiums for Medicare. So we discussed this in a previous education series I did about Medicare, but Medicare is not 100% free either. And so if for those who are low income seniors will qualify for what we call Medi-Medi, which is Medi-Cal and Medicaid. And that tends to be more almost like what we're trying to create with single payer. It covers pretty much everything. And because what Medicare doesn't cover, Medi-Cal picks up. So if there's a Medicare copay, Medi-Cal will cover the copay. And, we have all these different programs, but we could have just had Calcare. Never mind. Okay. So here's some things to consider. When you're looking for a new health plan, I want you to think about these things. What is important to you? For example, first thing, money. What is the cost? If you're having to purchase your own individual insurance, or even if you're enrolling insurance with your employer, what is the cost? Can you afford it? Most insurances or most employers tend to offer more than one insurance. Of course, the Covered California has multiple plans, as we explained, the tiers. So making sure, look at not just the monthly premium, what do you pay every month, but look at those deductibles, look at those copays for things that you may need to do. What providers can you see? So if you really have a provider that you're attached to and you're just changing your insurance for whatever reason, make sure that provider's a network. You can also ask them. So you can also ask the doctor's office saying, hey, you know what, I'm trying to change my insurance. I'm thinking of this. Are you in this network? Do you take this medical group? So that you can make the, proper decision, because so many people lose their access to their providers because they switch their insurance without checking that. What services are covered? This is important if you have chronic health conditions, if you have monthly medications that you take. So it's important to make sure that those your doctors that are managing your conditions and your medications are covered under whatever plan you're getting ready to select. So because that's once again has a disruption of care, and it takes a minute to to basically pull out of your insurance, and especially when you're outside of open enrollment. If you don't have a qualifying life event, you may be stuck for a whole year. That means you will have to go to a new provider, they'd have to get a new history on you, go through a whole new process, basically starting at zero to get you back to where you were with your previous provider, right? So prevent that, just making sure that the services or whatever it is that you need is covered under this new health plan. And then also, this is another big one about limits on visits. So there's certain like providers or treatments could have limits on visits. So like therapists, behavioral health specialists, rehabs, they may have limits on the number of visits you may be able to have in a year or whatever their period of time would be. So double check that. If you are, considering like, oh, you need physical therapy for an old injury, or, you would like to just have a therapist for mental health, just make sure that, the insurance that you choose covers these things. So each one of these, you might not have to look at all of this, but whatever is important to you is important for you to go look at when you're selecting your insurance, okay? Most importantly, do you know how much shorter this presentation would have been if we had Calcare? I think I would have been able to do like 4 slides. Yeah, probably. So I wouldn't have had to walk you through so much confusing crap under Calcare. And that is why I'm a strong advocate for it, because it does make my life extremely easy. You will still need me at some point, because the system still requires navigation, but I wouldn't have had to go through this as much as I just did, because Calcare is Calcare, which I wanted to share because this is what I do. The 7 basic principles of Calcare, which is universal coverage. We put everybody in, nobody out, regardless of your race, your gender, your country of origin, your disability status, immigration status. If you are here in California, you are covered under Calcare. And believe it or not, that is actually a little bit cheaper. It is a single public program, going back to single payer. It's publicly funded. We are the shareholders. Instead of your insurance company having to, basically go report back to the shareholders, you are the shareholder, right? So they're not the profit and everything, that whole, oh, I've got to report back thing just disappears because we are the shareholders. You get fully comprehensive benefits without, oh, this just essential coverage. Oh, you just get this, you just get that. And the decisions get made between you and your doctor, and you don't have to go around doing peer-to-peers. Oh, I need a peer-to-peer for this, and I need a peer-to-peer for that because the insurance doesn't want to cover this, and I need a peer-to-peer to keep the patient here. That's what I do every day. So obviously I'm a little bitter about that. And then you have your freedom of choice. You get free at the point of service. No more copays, premiums, or deductibles. Imagine that you really actually didn't need to know those definitions, right? And then just transition. So people who are working in the insurance industry, this includes, them getting transition out of that industry into a new job. And then patient care based on patient need. No more financial incentives to, avoid providing necessary care. No more networks being chosen due to rates. None of that. So that is why I'm a strong, believer in Calcare, because I know ultimately what I just explained, how to navigate covered California, how to navigate Medi-Cal, how to do this and how to do that, all would be a conversation of the bygone era if this is to pass. And that's it. Here's some resources to let you know I actually looked up things. Thank you guys for joining me and listening in on this. It has been a pleasure. And look, I came in under 1 hour. Yes.
Nice job, Jeanna. Thank you so much for that presentation. I am walking away so much more informed and smarter. I so appreciate you. And we want to open it up now to Q&A. I know we have some people joining us on Facebook. So if you're on Facebook and you have a question that you want to ask, just write that in your Facebook comment section, and Paul Newman can then share that with us here on the Zoom. And I'm going to put my glasses on. Oh, lots of praise, Jeanna, for you. And is there anybody on here on Zoom that has any questions or comments? Maureen, I see your real hand, not your cartoon Zoom hand. Go ahead and can you unmute, or do I need to? Okay, great.
Yeah, I'm unmuted. Thank you so much, Jeanna. That was fantastic. I wanted to point out, and maybe you have something more to say about this too, that Covered California is basically just a broker for private insurance. Is that correct? I mean, Medicaid and Medi-Cal, but all those plans are basically siphoned off to for-profit insurers, correct?
I mean, so is Medi-Cal. So Medi-Cal, typically you select a plan that's attached to the Medi-Cal too. But yeah, so that's why they could put them both together. It's one application, which is convenient. It is, but yeah, it pretty much is a broker. That's the whole point of the exchange. Is it's an exchange for you to get to one of the health plans. You have to pick one. Unfortunately, like it's just, yeah.
I just was making that point and asking, for confirmation, because a lot of people think somehow that Covered California is a public program. It's not. And I know that Covered California's CEO, he makes like more than $500,000 a year, and he gets bonuses based on how many patients go to which plans. So, he makes bank. It's not a public program. So I didn't know if there was any exception to that, but thank you.
No, I mean, the only public part is that the domain is, it's public access. The public can access it and enroll in the benefits. But yeah, you're still choosing a plan. There's no, like, you don't have the public option there. There's no, okay, Anthem, Blue Shield, United Health, Aetna, Cigna, Calcare. There's no Calcare option there. It's, you are forced to choose. So one of these private insurers. All right, Paul, and then Carol.
Yes, I was just wondering, can providers charge a concierge fee under Calcare? Are they allowed to do that?
No, not at all. They can opt out of Calcare though. So Calcare, doctors will not be forced to join Calcare. Just like in the beginning, they weren't forced to join Medicare. You are not forced to do that. You would be stupid if you don't. And I think that a lot of providers now consider Medicare to be their bread and butter. And so they will, if they can opt out, I think in the previous opting out would be like, I think a 2-year period. Where they could just be concierge and, do it all the concierge things. But for the most part, yeah, they would, I think they would miss out on a great opportunity. Carol?
Well, thank you so much for explaining all this confusion. I just want to say that one of the things that I've learned the hard way is that instead of paying each month through Covered California, or any plan that you might have to pay for per month that's not an employer plan, instead of writing a check every month or paying a credit card bill every single month, set up automatic monthly payment plan so that and just make sure your account is well stocked, because if you don't pay, you lose it. And this has happened to my child who's 26, and it's been a couple of months now. She still doesn't have insurance. So, and then I also wanted to say that when you do call an insurance company or Medi-Cal or Medicare, ask who you're talking to and ask for a reference number and take notes on the call, because it can all be very emotional and confusing. And you really want to hold them to what they told you. And you can tell them, hold on, I'm taking notes, so that you document all of it. You're like a secretary, or, you know, where you're really keeping track of this. You want to write down the date and the time also.
Yes, absolutely. Thank you, Carol, for actually hitting on that point. It is very important that when you're talking to the insurance, you do once again know that you're talking to a human. Just like every industry, the turnover, the great resignation has happened and affected everybody. So the person you may be talking to is typically a customer service rep. Their job is to filter and screen the calls and answer those basic things. But, you know, it is important to know that they probably could be very new, may not have experience, may not understand quite yet, just like as we were when we were new at things. So getting a reference number, documenting who, you know, and I do this all the time, like literally every day I'm talking to insurances and I get on the phone and I'm like, blah, 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 I'm doing this, blah, blah, blah. And then the last thing I do, because usually I always forget until the last minute, right before I hang up, I'm like, oh, who am I speaking with again? And then I write down their number. I was like, oh, and yeah, is there a reference for this call? And then they'll give me some very, very long number. But I make sure to document that in my notes in the patient's chart so that, you know, whoever follows after me will know that I contacted the insurance. This is the information that I was given and regarding this benefit or whatever I was trying to do. And this is the reference number for it. Because yes, it is important to hold them accountable, and you can get multiple different answers for the same question. So just keep that in mind. Like I said, I always forget it to the very end. It's always, who am I speaking with again? Yeah. And then sometimes I've even had it to where like I've had to call back the same plan or medical group, and literally I'm like, oh, I spoke to this person and they gave me this reference number, and they're like, oh, well, we don't know who that is. And I'm like, well, is this the reference number though, right, for the call? And they're like, oh, okay, yeah, I'll have to look that up, but yeah, I don't know who that person is. So they work in very big departments too. A lot of them are working from home, so they may not know these people because they're working from home as well. So those are just some caveats. Thank you, Carol, for touching on that. And then I see Farmars, you have, you asked about the 2 Medi-Cal insurers for LA County, which enrollees can choose in any comparison. So I know that there's an LA County, LA Care is a big one. That's one of the biggest Medi-Cal providers, which, you know, it's LA Care. It's kind of like, I don't have like, I can't give a real comparison, because if you really want me to be brutally honest, everything sucks. If you want my brutal honesty, everything sucks. Because they all give me a headache. But then there's Health Net. But then last year, the beef was that the word on the street was that, you know, Governor Newsom had slid Kaiser the Medi-Cal contracts. So Kaiser is now going to be, I think, the primary or one like get a ton of new Medi-Cal contracts too. So you have LA Care, Kaiser, Medi-Cal, Health Net, really managing a big chunk of the benefits for Medi-Cal. But see, even beyond that is the medical group. So there's the thing, you have a health plan, that is LA Care, that will be Health Net, that'll be Kaiser. Then you have a medical group under those, right? So Kaiser typically doesn't have a medical group, it's Kaiser. But then there's Health Net. Okay, there's Health Net with Healthcare LA IPA. There's Health Net with Ally Pacific IPA. There's Health Net with whatever, Optum IPA, name it, anything that you can think of as a name, I guarantee you there's some flipping medical group or IPA named that. Apple Care, there's just all types of different IPAs that are associated to the health plan. So it's not just the health plan that is your parent benefit. You have the medical group who is managing those planned benefits. And so your network is whatever that medical group network is, not necessarily the health plan. So for example, if you want to come to UCLA and Health Net is accepted at UCLA, your medical group may not have UCLA in its network, right? So you'll be stuck at that tier with the medical group, and the medical group would then have to approve you to come to UCLA, right? And so there's that too. Yeah.
I don't know any human being who watched this would like be like, I love this system and no to Calcare. I mean, this is insane. I have a headache.
And
This is-
day.
This is absurd. It's truly absurd. Are we in a comedy? Are we being punked? Like, this is ridiculous. And
Well, I mean,
none of this exists except high quality, comprehensive health care from the moment you're born to when you pass on. And like you said, Jeanna, the unhoused neighbor gets the same care as Governor Newsom and his family. And that's what makes Calcare work, because when those people are in the same system, they won't defund it. But as soon as you have these tiers, like you said, Jeanna, it's classist, bronze, premium, whatever. That's where the defunding comes in. And on top of it, they're making profits, right? Newsom's giving Kaiser the Medicare contracts. That's our public tax dollar is going to those CEOs. And, and then the people on Medicare are just not really getting very much health care, if any at all.
Well, they're being privatized too, as we've seen in the news. Medicare is being just as privatized as Medi-Cal because the health plans want to double dip. So what I can't emphasize enough is the greed here and the double dip, which is, you have employers paying these health plans, right, for their employees' benefits. Now they're tapping into, they tapped into Medicare, right, long time ago. And so now they're tapping into Medicare. So actually Medi-Cal, so they're triple dip. So they're like dip, 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 dip. They want to put their tendrils in all access of our care. But like I said, they don't report back to you. They don't give a shit about you, right? You are not, they say you're a member. You are basically the life source. You are for the parasite, right? So they're kind of just sucking off of the membership, but they're reporting back to the board of directors and to the shareholders. And unless you have shares, you are not in their interest. And I'm sorry, that's just the God honest truth, because I've been on that side and I've been in those rooms. You are not in their interest. Your interest, and we just talked about this with my coworker, your interest is to stay the hell out of the hospital. They don't want to see you. They don't want to smell you. They don't want to take your money. Do not use the benefit at all. Thank you. That is what they want. But ultimately, I see you, Maureen. Ultimately, what is going to end up happening is that we continue to have an income inequality that is growing, and that is going to be directly connected to our health outcomes. And then these insurance companies will start chewing into their record-breaking profits that they expect to get every quarter. And then they'll start getting even tighter. Right. So they'll become more stringent on utilization reviews, taking more time, delaying more care, which is actually something that, consumer watchdog and things like that, people are starting to look at a little bit more often. So it is literally, it is just an overall bad system. And people who are against public funding, thinking that there's going to be delays in care, I can guarantee you can walk into almost any ER right now in LA, especially the one where I work, it looks like a mass casualty incident. And this is a regular day. Patients in the hallway everywhere. Just because we do not have the resources to move the patients, they're sick as hell. So this is with your private insurance system. But I will say one thing, and more, before I go back to you, Maureen, this is a collaborative care. We have to all be invested in becoming a healthier society for Calcare to work, for any insurance to work. That's the whole purpose. They keep incentivizing insurance plans with money, thinking that the insurance will keep you healthier, but it won't. They keep taking the money, just like the banks took all the bailout money and did the stock buybacks. That's what the insurance companies are doing with their incentives. I don't know. I don't get to run things around here. I just get to talk about it. But yeah, that's the same thing that the insurance companies are doing with the incentives that they're getting, is that they're just basically doing stock buybacks. They're, investing in themselves, but not in you. And so, Maureen,
I just want to draw attention to Faramar's comment it's an illusion to make us think that we have a choice. It's like that the comedian said, of course you have a choice. Do you want what we give you or not? You know, that's your choice. And I was thinking even there's like a false choice, and that I know prevention screenings are supposed to be free, but with a colonoscopy, a friend of mine was told, yeah, it's free unless we find something. And if we find something, it's $9,000.
Yeah.
Okay. So he chose to pay out of pocket $3,000 to have a colonoscopy, even though it should have been free, because he was afraid if they found something, and believe me, they can always find something. Okay. Then it would have been $9,000 out of pocket, and it wouldn't be called a screening anymore. So it's all this horrible, vicious, really cruel game playing that is just disgusting when it's really all about money. And
Yeah.
it's not about healthcare. And a quick note on the public health. Countries that have universal systems stress public health. They stress diet, they stress nutrition, they stress exercise. They spend more money on outdoor recreation. They spend more money on subsidizing fresh foods. There is an incentive to keep people healthy. But we have a sickness system, and a sickness system, the incentive is to let everybody be as sick as possible. And so you're right about, we need to be healthier, but I was in public health and it began being decimated in the 1980s, and they absolutely have stripped it down to just about nothing at this point. So it's, you're right about that. We need those determinants, but government does play a role in that as well. So.
Oh, yeah, absolutely. So that's why passing Calcare is like, it is a big chunk of solving the problem, but it will not be a one-stop solve. So I don't want people, and even back when we were doing Calcare the first time around during office hours, you guys knew I'd be honest. I'm like, I'll be honest, Calcare is not going to completely solve the problem. It will be a big chunk in the solution though, for sure. But it will not be the completely just one-stop shop. And I think that I really want people to understand it. I think we've gotten into a one solution society, where it's like, I voted for you, now all my problems should be solved, right? I wanted this, I said yes to this ballot measure, so now all my problems should be solved, right? And I'm like, well, no, not exactly. We passed Calcare, so all my problems should be solved. And I'm like, well, no, because we had nothing to do with your out of control kids, but still, this is one piece of the puzzle, and it's a big chunk of that puzzle. It's kind of the piece of the puzzle that makes the rest of the puzzle make sense, right? That's what Calcare is, but the puzzle's still not done. Now you just make sense, right? So that's what we are trying to do. We're trying to make it make sense. But unfortunately, there's some people who probably don't watch what I'm saying right now, like your legislators, who are not seeing that big chunk of the puzzle. So if you do have a legislator that you would like to share this with, feel free. We are always ready to talk to our legislators, and we do. So please share this with your legislators, and invite them to come and converse and talk with us about Calcare. We really want to pass it. We really want to work with everybody, even those who may not be 100% on our side quite yet. You will be on our side after we talk with you.
Yeah. And what I will say, though, is you can't solve any of those other problems without Calcare. You will not solve medical apartheid without Calcare. So Calcare may not be the one, like past Calcare, and there's still work to do to end medical apartheid, but you can't incrementalize it the other way. So you can't solve, public health unless you pass Calcare. So it is the foundation piece. And on that note, are there any questions, Paul, from Facebook? Because if not, I'll move into the actions.
No questions. There is an organization though called DUH, Demand Universal Healthcare. DUH is one of the people that are observing this, so that's good news.
Well, hello, DUH. Thank you for observing. Thank you for joining. We appreciate you. We do have some actions coming up, but again, Nurse Jeanna Harris, political RN, you rocked it out again. Thank you so much. Love you, appreciate you. This was amazing. So, yeah, so let's talk about actions. Okay, this Saturday and Sunday is the big statewide Calcare canvases being kicked off by CNA. That's the California Nurses Association. Mwah, we love you. They are the authors of Calcare. So Saturday and Sunday, we got canvases going on. Healthcare for Us, we have several canvases in the Los Angeles area. You can find that information under our calendar section on our website, which is HC4US.org. That's like healthcareforus.org. But if you are outside Los Angeles, you can find all the Calcare canvases all over the state at events.medicareforall.org. That's the CNA website. Again, that's events.medicare4all.org. So if you are not already signed up to do a Calcare canvas, please go to events.medicareforall.org, sign up. There is crowd canvassing at parks, at farmers markets, and there's door knocking canvassing going on. So that's what's happening this weekend. On Thursday, I don't know if you know this, but Healthcare for Us is on the radio. We have a show every second and fourth Thursday on 90.7 FM in Southern California. That's KPFK. And our next show is this Thursday. The co-hosts are on here right now, myself, Maureen Cruz, Gina Viola. And then we got Scott, who's our tech producer. So he's on with us tonight. But check out the show this Thursday, 5 p.m. We're going to be talking about why Calcare is the single payer gold standard. Oh, you thought it was Bernie Sanders Medicare for All bill? Nope, nope, nope. It's Calcare. That is the gold standard. So tune in. Again, that's this Thursday, 5 p.m., 90.7 FM. And if you don't have a radio, well, then go get one. Just kidding. I do love my little kitchen radio, though. If you don't have a radio, you can listen to the live stream on our website, hc4us.org. And we'd love for y'all to call into the show. So tune in, call in this Thursday at 5 p.m. I think that's about it. Maureen's nodding her head, so I know I got it all. If you enjoyed this program, if you're going to share this program, if you learned something from this program, please put 5 on it. Please donate to our organization. How do you do that? You go to our website, hc4us.org. As we said earlier, we are an all volunteer organization, but we do have expenses. So your contributions help sustain us in doing this work in the single payer movement. And so before I head out, I want to give a big thanks to all of our cherished board members who make this event tonight, make our radio show, make our organization run. We can't do it without all of you. So big thanks to Maureen Cruz, Bronwyn Major, Chung Sim Lim, Carol Fodera, Paul Newman, James Sarantinos, Gina Viola Peak, Scott Viola Peak, and of course, our speaker tonight, Jeanna Harris. We love you. We appreciate you. Thank you. And remember, single payer is the solution. So join the healthcare revolution.